Hi everyone and welcome to our Rights Theory breakdown of universal healthcare versus privatized healthcare. The short video will explore how the concept of human rights applies into two different systems such as the universal healthcare and privatized healthcare through the lens of rights theory. So let's begin with a simple visual comparison of the two different systems.
The Department of Health o DOH under the Republic Act of 4226 or the Hospital Licensure Act of 1965 is mandated to issue licenses to those who plan to establish and operate hospitals through the Philippines. This is to ensure safety of the patients. The responsibility of issuing licenses was initially assigned to the Bureau of Medical Services, which is now known as the Health Facilities and Services Regulatory Bureau. Through HFSRB and its regional counterparts, the DOH currently regulates 19 types of healthcare facilities and services. Aside from hospitals, the DOH also issues licenses to infirmaries, birthing homes, and other healthcare facilities. At the present, DOH regulates approximately 11,800 healthcare facilities, and this number continues to grow. With the approval of the Republic Act No. 11223 or the Universal Healthcare Act, DOH was directed to license all primary healthcare facilities in the country, including rural health units, health centers, barangay health station, and private clinics, to address the increased responsibility of the DOH due to continuous rise in the number of healthcare facilities requiring licenses. Efforts are being made to ensure the quality of healthcare services.
In a universal healthcare system like in Canada or the UK, people get medical care without paying upfront or showing insurance. It's funded by taxes and everyone has access whether they're rich, poor, employed, or unemployed. The focus is on healthcare as a public service. In contrast, a privatized system like in the Philippines has access to insurance and income. People might avoid healthcare due to high costs or be limited by what their insurance covers. Here, healthcare acts more like a product available if you can afford it. Like, when I was injured due to an accident and my friend brought me to a private hospital, the hospital refused to treat me because my guardian is not present and they don't have the assurance that we can pay for the treatment. They gave me first aid instead and wait for my guardian to arrive. This system reflects different values. Universal care sees healthcare as a shared right, privatized care sees it as a personal responsibility. This now leads to a bigger question. Is healthcare a right? If so, what kind of right?
In Canada, they have a single-payer system
where the government funds healthcare for everyone through taxation. Doctors' offices tend to be private businesses that get paid directly by the government, but hospitals and operating tables are public property, and hospital staff are public employees, sort of like public schools. This is often called a single-payer system since the government is doing most of the paying. Canadians have to pay for prescription drugs, eyeglasses, and dental care themselves, or get them through supplemental private insurance.
Divides rights into two categories. 1. Negative rights protect individual from interference like freedom of speech or religion. Another one. Positive rights are entitlements to something like food, shelter, or healthcare. When applied to healthcare, negative rights will protect a person's freedom to choose their own provide or to claim care. Positive rights will mean everyone is entitled to receive medical treatment regardless of their income.
Supporters of universal healthcare argue that it fulfills a positive human right. The Universal Declaration of Human Rights even states that everyone has the right to a standard of living adequate for health and well-being. In practice, the universal system aims to guarantee access to care, helping prevent health disparities based on wealth, race, or social status. But without this system, people may skip needed treatment because they can't afford it, leading towards health and even financial ruin.
Those who favor privatized healthcare focus on negative rights, especially liberty and economic freedom. They argue that individuals should have the freedom to spend their money how they choose and pick plans that suit their needs. The system can offer more choices and faster access to specialized care, especially for those who can afford to pay for premium services. But critics point out that this freedom often comes at the expense of equality. Some people simply get left behind.
So here's the ethical conflict. Universal healthcare supports the positive right to health. Privatized healthcare protects the negative right to liberty. But when these rights conflict, which one should take priority? Universal systems may lead to longer wait times or fewer provider options. Privatized systems may offer more autonomy, but only for those who can afford it. So each system sacrifices something in order to uphold a different kind of right.
Many countries now use hybrid system, blending universal coverage with private options. These models try to balance collective responsibility with individual choice. Right theories doesn't tell us which system is better, but it helps us ask the right question. Do we value freedom more than fairness, or equality more than autonomy? The answer shape not just for our healthcare system, but our values as a society.